This video will focus on ethical principle number 4, outlined in BCCOHP's Professional Standards for the Oral Health Team. The BC College of Oral Health Professionals protects the public by setting clear expectations for the delivery of safe, patient-centered oral health care. That's where BCCOHP's Professional Standards for the Oral Health Team come in. They take a modern, unified approach on the minimum requirements for ethical and professional conduct of oral health team members. The professional standards are organized by overarching principles for oral health care that act as a guide for how to provide safe, collaborative, and patient-centered care. The fourth ethical principle is to communicate effectively and obtain informed consent. As an oral health professional, you have an ethical responsibility to communicate clearly with your patients and ensure they are making informed decisions about their care. This includes things like communicating with patients and their representatives in a way they understand, fostering two-way discussions and listening to patients to understand their needs, providing all reasonable treatment options, including the option of no treatment, and making sure your patient understands what to expect, including risks, benefits, costs, and outcomes, obtaining informed consent from your patient before providing care. Consent is dynamic and not a one-time event. Actively supporting patients in making informed decisions about their care and respecting their right to choose their own care, and informing patients when things don't go as anticipated. So what does this look like? Well, it could include working with your patient's representatives, guardians, or support people to accommodate communication barriers such as language, and ensuring your patient and their representative understands what you are telling them. Allowing enough time for an open discussion to enable your patient to ask questions. Taking the time to listen to your patients and understand how the treatment may impact them holistically. Reaffirming informed consent when there are changes to a treatment plan. Respecting your patient's right to change their mind and withdraw consent at any point during treatment or to seek a second opinion elsewhere, and letting your patient know as soon as an issue arises and discussing the consequences and possible solutions with your patient so they can make an informed decision about what to do. For more information about your requirements as an oral health professional, please read BCCOHP's Professional Standards for the Oral Health Team document. Thanks for watching!